You're welcome to Doctor in the House, which is every Thursday right here on ChannelOne TV with subsequent broadcasts within the week. Joining me is Dr. Kelvin Owusu. He's a wellness consultant with Violet Medical Center at Kwabena. And today we're discussing diabetes and your feet. Doc, Happy New Year.
Hi, Happy New Year. Good to be here.
Good to see you. How are you doing?
Very well, very well.
The year has started well?
It has started well. I mean, the traffic tells you that it's going to be a productive year.
I like that. I like that. Doc, going straight into the conversation, why are people who have diabetes prone to foot problems?
So, I mean, that's a very important point. And indeed, everybody who is diabetic has a major problem or major risk of developing a foot problem. But before then, I mean, let's just recap a little bit on what diabetes is. But for the stubborn boys at the back, they missed the
last
time.
episode.
So basically, diabetes is a condition where, or diabetes, when you use diabetes loosely, it refers to your body's inability to process sugar.
Okay.
There's another type of diabetes that we don't talk about often because it's not too common. So generally, when you mention diabetes, you are referring to the one that affects the sugar. You know, so when your body struggles to maintain normal sugar levels, then we say you're diabetic.
Right.
So for most people, the sugar tends to be higher than normal. And it's because of a problem with the pancreas. It's either the pancreas is not producing adequate insulin, in which case we say you have type 1 diabetes, you know, or your pancreas is producing plenty insulin, but the insulin is not effective in controlling your blood sugar. That's type 2 diabetes, which is the most common diabetes. It's the lifestyle diabetes, the one that most people are going to develop because of the choices they make, the poor diets, the lack of exercise, among other things.
Right.
So when all those happen and you do now develop the diabetes, the type 2 diabetes, then you have a high risk of developing foot problems.
Okay.
And the reason why the feet are very, very important to us medics when it comes to diabetes is because of a couple of things. The first one is that diabetes as a disease, because of the high sugar, it destroys the blood vessels, both the big and the small blood vessels. You know, I'm sure you may have come across a term called atherosclerosis, which is cholesterol or fat being deposited inside your blood vessels. You know, so when that happens, it limits how much blood can actually go through the blood vessels. And diabetes speeds that process up, you know. And so the legs, because the legs are the most distant part of the body from your heart, you know, the atherosclerosis occurs more commonly in those blood vessels. And so it limits how much blood is actually going into the feet. And so because of that, there's a condition called ischemia, which is poor oxygenation. So oxygen is not getting to the foot or the feet. And as a result of that, your risk of developing ulcers, that is wounds, is very high. You know, because oxygen, I mean, obviously the blood carries oxygen, carries nutrients, carries white cells, carries things that will nourish the feet and make it healthy.
Right.
You know, so if you are limiting how much blood is going there, it puts the foot at risk of various conditions. So that's just one reason why the feet become problematic in diabetics. The second thing, still related to the high sugar, is that the sugar becomes toxic to the nerves. You see, so the nerves are what makes you feel things. You know, so when somebody touches you, when you step on the floor, it's the nerves that communicate that, okay, you're stepping on something sharp or something hot, something cold, you know. Now, because the blood sugar levels are so high, the sugar begins to seep under the skin. The nerve endings are also under the skin. This condition kills the nerve endings. Right. So people with diabetes begin to develop conditions like, which you have generally called neuropathic problems. So their sensation is impaired. They cannot feel things. So they cannot tell the difference between a sharp object. I mean, I'm talking about in their feet. They cannot tell the difference between a sharp object and a blunt object. They can't tell the difference between a cold object and a warm object. You know, I mean, I actually have this experience with a patient. So this is an old woman, and in the village, she's cooking. You know how they cook with the stones with the sticks in there. Yeah. So she's cooking, and there's no meat in the food she's cooking at that point. But then she's smelling something like roasted. Somebody is grilling meat. Wow. And you know, now why not? I mean, who is roasting meat? Then somebody comes into the house and says, Auntie, now you know your leg is literally sitting on the fire.
Wow.
but she cannot feel it. Yeah, and that's how bad diabetes that's how bad the damage of diabetes can become.
Okay.
You know, so she's literally standing, her foot is on the fire, on the burning wood, and she wasn't feeling it. She was actually smelling it, and she was wondering who is grilling meat. You know, when indeed it's her own food that was being grilled. And this actually, she actually ended up in also. That's how I came across this story. I mean, it's funny now, but I mean, it was a big deal.
Wow.
You know, so the nerve damage makes you impairs your ability to feel things, you know, and so that's number 2. Now, when you now combine these two things, then it brings us to number 3 reason why the foot is important, because now you're not feeling things. The nerves are killed, in quotes. The muscles that maintain the shape of your foot are controlled by the nerves.
Yeah.
Now, if the nerves are not functioning, it means that the muscle tone is also going to be affected. So now diabetics, if this condition progresses, they begin to have deformities in their foot because the muscles are not doing their job. You know, so the foot has a certain arch, you know, that's supposed to be there to help you walk properly. So they begin to develop problems with these arches, and then they cannot walk properly. And then because they are not feeling pain, they are not even able to tell that there's a problem. So they keep walking on the deformed foot, which then results in fractures. You know, and because of the poor blood circulation, the healing of the fracture becomes a problem. So then they develop new pressure points. You know, your feet have natural pressure points.
Yeah.
When you step, it's not the entire foot that is feeling the pressure. You know, you have the heel, you have the ball of the foot.
But some have flat feet.
So that's why so if you actually pay attention, the military, they will tell you that they won't take somebody with flat feet, because they tend to struggle with some of these things because of the impaired pressure points in their feet. So if you're diabetic and your foot now begins to get deformed, and you start developing new pressure points in areas where the skin is not accustomed to this to pressure,
right,
then you start developing pressure ulcers. You know, they start developing different new things that would have been in other places that are developing, like the bunions and the corns and all of those things. So their foot becomes deformed.
Right.
That's quite extreme. You know, so we don't want you to get to that point at all. You know, because once now you've developed the ulcer, the healing of the ulcer now becomes a problem, because remember initially I told you that the blood circulation is even poor.
Yeah.
So the white cell that would have gone to fight off the infection or the ulcer to promote the healing, they are not able to get to the destination. You know, and so the ulcer does not heal. And eventually, this is what now results in amputation. So diabetes is actually the #1 cause of non-traumatic amputations of the lower limb.
Yeah.
You know, the most common is accident. I mean, you are in a road traffic accident and then your leg has to be cut off because something has happened. But if you remove accidents from there, diabetes is the #1 cause of non-traumatic lower limb amputation. So it's a big deal. Yeah. I mean, it's not something that we can overlook at all. So, I mean, if you are diabetic and you don't pay attention to your blood sugar, you could lose your legs.
What is meant by the term diabetic foot?
So, I mean, the diabetic foot is just a term that encompasses all that I've described.
Okay.
You know, so the poor circulation, the nerve damage resulting in an ulcer, you know, and the ulcer could have just started from something that almost everybody has had in the past. Foot rot, athlete's foot, you know. You develop athlete's foot, and in a matter of days, it's healed and gone. If a diabetic who has poorly controlled sugar develops athlete's foot, because of the complication, the poor circulation, the nerve damage, that athlete's foot can begin to spread and then results in a diabetic ulcer.
Right.
You know, so the term diabetic foot is just putting all these things together, you know, as a should I say generic description for a foot problem that has developed in a diabetic.
Who's most at risk of developing a diabetic foot? Is it that the minute that you have or you've been diagnosed with diabetes, automatically it means that your legs or your feet might be affected? So
that's not an easy question to answer. The problem is that most people who are, at least in our setting, most people who are diagnosed with diabetes are diagnosed quite late. So for some people, the first time they're actually being diagnosed is when they've come in with an ulcer that's not healing. You know, so doctor, I developed this wound in my leg, and for the past 2 months, it's not healing. What's going on? Then we ran tests and realized that no, this person is actually diabetic, you see. So that's what makes it difficult. But if we were doing regular screenings, for instance, and we knew that you were diabetic, then we can put measures in place to prevent the development of diabetic foot. So generally, people with poor blood sugar control are the ones who are at most risk of developing diabetic foot ulcers. You know. But so basically that means that if you are diabetic and you are not taking your medication, for instance, your blood pressure, your blood sugar remains high all the time, then your risk of diabetic foot is high. And not just diabetic foot, there are so many other complications as well. I mean, there's the diabetic eye disease, kidney failure, even heart disease as well. You know, so diabetes actually affects the whole body.
Every part of your
yes,
body.
Diabetes actually affects the whole body, and that is why it's important that we screen for it. Thankfully, unlike hypertension that does not have any symptoms, diabetes tends to have, like diabetes will tell you that I'm coming. You know?
How does it do that?
So the most common symptom of diabetes is, or the most common group of symptoms of diabetes are, so you begin to urinate a bit more frequently.
Okay.
And every time you go and urinate, it's large volume, like a lot of urine.
A lot of urine.
You know, in the old days, or even now, some people, when you urinate outside, ants will gather around your
so that's
urine.
not a myth?
No, it's real, you know, because the sugar is so high that it is seeping through your kidneys and coming out through your urine. So when you actually urinate on the floor, ants gather around it, and if you are adventurous enough to taste your urine, it will actually be sweet. Indeed, that's where the name diabetes mellitus comes from. Okay. I mean, way back in the day, the doctors actually had to taste their urine to determine whether you're diabetic or not. I'm happy I wasn't a doctor those days, but you know. So that's actually where the name comes from. Diabetes mellitus means sweet tasting urine.
Oh my word.
You know, so that's on the urination side. Then increased thirst. Obviously, you are urinating a lot of volume, so you become thirsty. So you are drinking lots of water.
Right.
You know, and you are urinating a lot. Every time I say this, people will say, but doctor, I mean, I drink a lot of water. Is that normal? So, I mean, it's hot. So drinking a lot of water itself is not a problem. So where we try to find the cutoff or a difference is, do you wake up in the night to urinate, and how many times? So if you are urinating 3, 4, 5 times in the night, and each time you go and urinate, it's a lot of volume, and then you are waking up to drink water because you are thirsty, then it means that it's not just because the weather is hot. There's something else going on that you need to pay attention to, you know. Then there's weight loss, or let me say sudden weight change. So you are eating, you haven't planned on losing weight, but then suddenly you are losing weight. It could be a sign that there's diabetes in there. Or you are gaining weight significantly, it can enhance or increase insulin resistance, which can also then lead to diabetes. So these are some of the symptoms. Then there's increased frequency of infections. So in women especially, you have, let's say, candidiasis.
Right.
You've gone to treat it. In a month or two, you have candidiasis again. Another 2 months, candidiasis again. Recurrent candidiasis could actually be a sign of diabetes, you know, or recurrent UTIs, recurrent boils or abscesses in your armpit, in your groin could be a sign of diabetes, because the high sugar impairs or restricts the work of the white cells. The white cells are like the defenders, your defenders,
right.
You know, and because the sugar is so high, you restrict how much work they can do, and that is what makes you develop all the, recurrent infections, you know. So these are some of the symptoms of diabetes. So diabetes is not as silent as hypertension,
okay.
You know, but we ignore it. We ignore it and we end up diagnosing it late. And so that is why, like I said earlier, oftentimes the first time people are diagnosed is when they actually come in with the ulcer having already started. Okay. You know.
So there are signs and early warning symptoms,
yes,
but we just ignore them.
Exactly.
Yeah. I mean, I have more questions for you, but so do our viewers. So let me read a few of them. Good morning, doctor in the house. Please find out whether children are prone to diabetes. And this is from Farida and Suhum.
This matter. So in the past, diabetes was a disease of old people. Well, let me say type 2 diabetes, the one that comes with lifestyle, was a disease of older people. Today, that's not the case.
Right.
Today, we are getting children developing type 2 diabetes because of childhood obesity.
Oh.
You know, when we were growing up, we were playing football. You go and play football, and they come, they'll beat you.
They'll beat you.
Know. But that was actually what kept us, you know, healthier for a longer period.
Right.
Today's children, they are doing video games and other things. So they are eating a lot more junk food than we were eating. I mean, when you close and come back from school, there's some PC on the fire for you. Which one is the fast food? But now it's all fast food and junk food, you know. It's because of that our children are becoming bigger and bigger. And I'm not talking about healthy weight. I'm talking about overweight, which is a problem. So children are developing type 2 diabetes earlier, you know, than in the past. And that can actually put them at risk of these complications at a much younger age, you know, because you'd realize, I mean, most of the people with diabetic foot were older, I mean, 50s, 60s, 70s. It's likely that we are going to start seeing it earlier, especially if our children, we don't change the culture around our children and also our health-seeking behaviors, you know. So it's a problem. It can actually be, we are seeing it in children today more than before.
Nana in Kumasi wants to find out if It says, if I am pre-diabetic, what should I do?
So if you are so being pre-diabetic or pre-anything, there's also pre-hypertension. It's a sign that you need to put measures in place. So if you are pre-diabetic, it means we can reverse it. You are not yet diabetic. You are inching closer and closer. There's a cutoff. When you check your blood sugar, your fasting sugar. So when you wake up in the morning, we'll say don't eat. Your last meal should probably be about 8 p.m. the previous night. You wake up in the morning, you quickly go to the lab, they check your blood sugar. That figure you see, it should be less than 7.
Right.
If it's more than 7, then you are diabetic. If it's approaching 7, then you are pre-diabetic. I mean, we will need to do further testing to know for sure, is this proper pre-diabetes or is just diabetes that has been masked by some good habits. There are further tests that we can run. So if you are pre-diabetic, it means that we can reverse it. So this is where you put in the lifestyle changes. So the exercise, the improving your diet, so that you can begin to reverse some of the things and losing weight. Ultimately, fat is what blocks insulin. So the more fat you have in your body, the higher your risk of insulin resistance. And when you have insulin resistance, it means that you need more insulin to overcome that resistance to now push the sugar out of the blood. So if your body is not able to produce enough insulin, then you have diabetes. Right. So that's why when I started, I said that type 2 diabetes, the body is producing a lot of insulin, but the insulin is not being effective. And what is making it ineffective is actually fat. So once you put measures in place to lose weight, your blood sugar will naturally decline. So people who are pre-diabetic, they don't need to be put on medication. Just by lifestyle modification, they can actually improve. But when you are now diabetic, then you need to be put on medication. So the medication could just be tablets, or could be insulin. So you might have to take insulin injection to increase the amount of insulin in your body to try and overcome the resistance, so that your blood sugar can come down.
Can it be cured?
So I mean, it's again, it's not a yes or no answer. Everything is possible. If with proper lifestyle modifications, you can reduce your blood sugar, and if that blood sugar reduction now drops below the cutoff, then you are no longer diabetic, even though you have that risk. You see, and so you still need to be monitoring your blood sugar periodically to make sure that you are within the acceptable range.
There's a question here. Daryl from North Kaneshi wants to know what lifestyle changes can help prevent diabetes.
Okay, so I think I just touched on it in the previous response. So basically, like I mentioned, the goal is to maintain a healthy weight. At the moment, we are using BMI. There are other measures that we can also use to assess weight. There's the waist to hip ratio, among other things, but just for ease of reference, BMI. So if your BMI is above 24.5, then we say you're overweight. If it crosses 30, then you're obese. So there are a lot of us walking around who think we are okay, but actually we are obese. Now, and in the obesity, there's class 1, class 2, class 3.
Oh, wow.
So depending on how far you are from the normal is below 24.5, as I mentioned. So depending on how far you are from there, then we need to start reducing our weight. So what measures can you put in place? You have to watch what you are eating. Weight is basically input and output. If you are eating too much and you're not exercising, you are going to keep the balance. The balance is what you add on as weight. Okay. So watch what you are taking in, possibly cut down what you are taking in, or substitute what you are eating. Instead of white rice, white flour, white sugar, switch to the less processed versions, the brown sugar, the brown flour, and the brown rice. Then increase your output, work output. Instead of driving from home to work, maybe drive from home to the junction and walk the rest of the way.
Dog, by the time you get here, you'll be sweating.
But that is good. So that's why we probably have to start incorporating, changing rooms and bathrooms in our workplaces, so that people can actually exercise. You can jog to work, go take a shower, and then dress up, come in.
So sedentary lifestyle is a no-no when it comes to
It's a big no-no.
Sugar.
It's a big no-no,
right.
And it affects your blood sugar, it affects your blood pressure, it affects so many other things, And so you want to reduce your weight as much as possible. I mean, as part of New Year resolution, maybe everybody should add a goal to increase the amount of exercise they are doing, right. Because you cannot go wrong with exercise. To a large extent, exercise is good, especially if you are doing it in moderation and regularly. The thing is, people exercise once a week. Once a week exercise is not the best. You need to be doing at least 3 times a week, 30 minutes of sustained exercise 3 times a week. That's what you need to do. So how you can incorporate this into your lifestyle depends on your lifestyle. So if you're a corporate worker and you cannot find time to go and exercise, then you have to find a ways and means of walking to work or exercising on your way to work, so that it becomes part of your, that's why it's called
balance.
lifestyle, you see.
Yeah. All right. Let's say you have diabetes, you've been diagnosed. What can you do to prevent your foot, or what daily activities can you do to prevent your foot from being affected?
This is very, very important, you see. Now, remember that we have mentioned that the sensation is not there.
Yeah.
So you cannot live like the regular person is living, wearing any shoe you want, walking around anyhow you want. So the first thing is that you need to visually inspect your foot every day. This is every day. Yes, every day. You must actually look at your foot and make sure your foot is fine.
What are we looking for?
You are looking for cuts, bruises, the color, the shape, anything out of the ordinary. You want to actually look at your foot yourself. Make sure that you are seeing the foot. Turn it upside down, look under it, make sure that there's no problem. Because if you depend on feeling, it'll be too late.
Right.
You understand? So don't wait to feel something on your foot, because as a diabetic, the risk that you're already developing the neuropathy is already there. So don't wait to feel something. So visually inspect your feet every morning. It's actually, you need to do it every morning. And at least once a year, you need to go in for a specialist to look at the foot as well. But that's just once a year. But you yourself must physically look at your foot every day. When it comes to footwear, you want to make sure you're wearing shoes that allow the shape of your foot, that accommodate the shape of your foot. So if you're a woman, for instance, you cannot wear your shoe as a diabetic.
You can't wear heels.
You can't wear your shoe at all. Because at the front of your foot is bringing the toes together.
Yeah.
Because the diabetic, you have feeling in there. So if it's too tight, you can tell this shoe, there's something wrong with this shoe. Let me take it off. The diabetic cannot tell that the shoe is too tight.
Okay.
So if by the time they take off the shoe, the damage would have already been done.
Right.
You see what I'm saying?
Yeah.
Then the heel, it cannot be too high, because once it's high, there's pressure on your heel. Again, you can feel that there's too much pressure on this one, so let me not wear it. The diabetic will not have feeling over there to tell. So by the time some men are wearing high heels now, so by the time you take off the shoe, the damage is already done. You see, so you need to wear comfortable footwear that accommodate the shape of your foot, preferably open toe, so that there's something going on. Even if you can't see, somebody can see and tell that your toe, there's something wrong with your toe, please go and check it. So open toe is preferred to closed toes for the footwear as a diabetic, especially if you already have the neuropathy that we are discussing. Then when it comes to your toenails, you see, you shouldn't keep your toenails too long.
Okay.
Because when it's too long, again, pressure can cause damage to the toenail, and because you don't have feelings, it will become a problem before you notice it.
Right.
You see. And then don't cut it too close to the skin either, because the closer you cut it to the skin, there's a risk of injury.
Right.
And because you already have problems with wound healing, that injury could be the beginning of the diabetic foot ulcer. So don't cut it too close to the skin, and don't keep it too long. Yeah, we need to find an acceptable place where everybody will be okay with it.
What about pedicures?
We need to get the right people to do the pedicure. Sometimes when you do pedicure and come, you yourself, you see that no, he has cut my toe too deep. You don't want an inexperienced person to do your pedicures, So you either do it yourself or find somebody who understands what you are going through to do it for you.
Okay.
So that you don't cause damage to your toes.
For the women, can they paint their toenails?
So long as there's no problem going on there, you can paint your toenails, But for instance, there's a cut over there. You don't paint over it, because that could introduce infection into the cut and cause you problems. You see. So I think that basically, whereas some of us, because we don't have any problem, we can take our feet our legs for granted. I mean, you wake up in the morning. Have you ever tested your feet before you get out of bed? No, you just swing your legs over the bed and get up and you're going. The diabetic needs to be mindful of his or her feet, because it's not going to be business as usual. Always inspect, and the visual inspection is the most important, because you must see your feet and make sure everything is fine. If for some reason you are unable to bend down to look at your feet, find somebody who can inspect your foot every single day. Because as I mentioned earlier on, something as simple or as small as athlete's foot can be the beginning of a problem that will end up with you requiring an amputation.
Right.
Yes.
How are diabetic ulcers treated? So
the treatment is very complicated, and that's how come it typically would end up with an amputation. You see, because the sugar under the skin is rich it's a rich medium for bacteria.
Right.
You know, and the bacteria is, bacteria, once the environment is rosy, they are just multiplying. You know, so they are spreading quickly. You know, so sometimes the easiest way to deal with them is to just chop off the foot.
Oh,
you
wow.
know, but the goal is to reduce the blood sugar. You know, but the reason why I say it's complicated is that the ongoing infection will already put stress on your body, and your body's response to stress is, I mean, as part of the stress response is to organize more sugar, because you need sugar for the cells to work. You know, so the ongoing infection means your body is going to generate more blood sugar. And then the treatment requires you to reduce the blood sugar. So it's your body is increasing sugar. You are trying to reduce sugar. So it's it's a complicated, issue. You know, but if we catch it early, we're able to overcome it, and then the wound would heal. If we are not able to bring down the blood sugar, the wound will not heal.
Right.
You know, so that is what becomes a problem. And the unfortunate thing too, I mean, of course, it's part of our sociocultural issue that we are dealing with, is that healthcare is expensive.
Yeah.
You know, you don't come to the hospital one day and then your ulcer is treated. You have to come multiple times. Most people are unable to keep up with the reviews, and then they drop off and go and apply herbs and other things. And these herbs, even though the herbs may be good, the way they are treated is not the best, and so the herbs now end up introducing more infection into the wound. You know, so it's a big problem. So then you see it sets off a vicious cycle where they will tell you that if you take this your leg wound to the hospital, your leg will be cut off. And indeed, because they sat there and wasted so much time, the wound has festered, has become so big, we're not doing about it, the leg has to be cut off, which kind of confirms the thing. Say, I told you if you go, they'll cut off your leg. But indeed, if you had come earlier, we wouldn't have cut off the leg.
Yeah.
You know, so it's a big problem that and that's how come, like I said, diabetes is the number one cause of non-traumatic amputation, lower limb amputation. If to break that cycle, we need to institute regular checkups for ourselves. You know, so that if you are diabetic, we catch it early and start treating it quickly, so that if there's going to be a reversal, it will reverse, and whatever damage is going on, hopefully will reverse as well. And then you don't end up with your leg being cut off, or blindness, or kidney failure, all the other complications of diabetes.
Would that be the tip for the day?
Well, I mean, the diabetes, the tip for the day is that diabetes, even though diabetes is a sugar metabolism problem, it's not just about the sugar that you're eating.
Right.
You know, because sometimes you tell people that you are diabetic and say, but I don't even eat sugar, I don't put sugar in my food. No. So everything you eat, whether it's rice, bangkun, etc., is converted to sugar. And that sugar is what your body struggles to metabolize. So it's not just about the sugar that you have added to your tea, or your sugar that you have added to whatever else that you are eating. You know, even though that is important as well. So as much as possible, health checks is one of the best things to do for yourself this year. Make it part of your resolution to have a health check. You are not sick, you don't have headache, you don't have anything, you're just coming to the hospital for a checkup.
Yeah.
At least do it once in one time this year. Your body will thank you.
Thank you very much, Doc.
Thank you for having me.
We appreciate your time. Well, that has been Doctor in the House. Don't forget to take care of yourself. It's very important. We'll be right back.